So your child's deaf. Now what? Terms you may hear a lot. Cochlear implant. A surgically implanted device that replaces the function of the damaged inner ear to send electronic signals to the brain. Baha. Bone-anchored hearing aid. Enters its sound output into the cochlea by vibrating the mastoid bone, the large bony mass just behind the ear, instead of by directing amplified sound at the eardrum. Sensory neural hearing loss. When hearing loss is due to problems of the inner ear, cochlea, and associated structures, or the cranial nerve 8. Conductive hearing loss. When hearing loss is due to problems with the ear canal, eardrum, or middle ear and its little bones, malleus, incus, and stapes. 504. Part of the Rehabilitation Act of 1973, an anti-discrimination civil rights statute that requires the needs of students with disabilities to be met as adequately as the needs of the non-disabled are met. IEP. Individualized education plan or program developed to ensure that a child who has a disability identified under the law and is attending an elementary or secondary educational institute receives specialized instruction and related services. Unilateral hearing loss. Hearing loss in one ear. Bilateral hearing loss. Hearing loss in both ears. Universal newborn hearing screening. Given during the first few days after birth, test the newborn baby's ability to hear. Early intervention. Intervention that assists the child in developing age-appropriate skills prior to attending school. ALDs. Assistive listening devices, such as a cochlear implant, hearing aid, BAHAs, etc. Audiogram. The chart that explains your child's hearing loss. Who to contact. Audiologist, ear doctors. New Jersey Speech and Hearing Association. AGBELL, NAD. Local schools for the deaf. What's the difference between spoken language and American Sign Language? American Sign Language is a visual language where the brain processes information through the eyes. Oral communication, spoken languages, is expressing information or ideas by word of mouth. Note, there are many sign systems and other methods of communications. However, these are two language options to choose from. Different interventions. Auditory verbal therapy, AVT. Speech and language therapy, private practice or in a school system. Summary link.